Good evening from my house. It's Mitchell Talks Health Watch Oklahoma, and as always on Wednesday nights, here's the guy. Just let him know how much we appreciate him. Jeff Dismukes. So I actually had just got the sound pads working, so I thought you'd be the first one to get some applause line too. How are you, man?
I'm good. I need that. I'm gonna hook it up around the house and hit the speakers whenever I enter rooms. It works out well.
It works well. It works well. I've got a good program for you tonight. We're going to be talking about things in the news. You know, we recently observed the anniversary of the Murrah building bombing, and a lot of survivors experiencing the loss and the trauma and just the grief of that time. Comes around every year. But we don't forget that time of year in Oklahoma. And we're going to be talking about that tonight. Jeff's been talking with folks about that, brought a great panel tonight to discuss that. A lot of things that are happening in that realm. You know, we're talking pretty frequently about what's going on with this new county jail, which is like 60 something days, Jeff, before the election, which would just be the first step if they approve the bond issue, which is late June, which is the primary for everything. And we'll be talking about all about that. At the bottom of the hour, we're going to be, and I think we said this before, that this Wednesday nights are now the home of the Speakers podcast, exclusive that we do each week with Speaker McCall. And we're talking about what happens in the month of May, which is always mysterious, hard to follow. You know, there's the first 3 months are orderly. Well, somewhat. You know exactly what the deadlines are. You know what time they have to be there. You know what the calendar says. It's not that way in May. So we've been laughing over the past few weeks. These really young reporters who earlier in the session were going, well, the bill's dead for the session. Ain't nothing ever dead. Ain't nothing ever dead till they sign and die. And so watching them go through that learning process is you ain't seen nothing yet. The first time you're covering legislature and you get to May. So that's at the bottom of the hour. We'll be taking your questions if you have some here on Health Watch Oklahoma. And Jeff, why don't you introduce our guest this evening?
Well, we have with us a couple of folks. Lorna Garder from the Department of Mental Health and Substance Abuse Services. That's a really long title. She's the expert on trauma and everything about that and how it relates to behavioral health services. And then Lorna Palmer, who's the executive director of NAMI Oklahoma. We have on with us tonight, and really happy to have everybody here. I appreciate y'all taking time out of your schedule to be with us.
Glad to be here. Thank you.
So,
thanks very much.
One of the things that Lorna and I get to work together often, and over this last week, Scott mentioned the Murrah bombing. We had a chance to do some interviews around that. There also was a high-profile case, sex trafficking case in Oklahoma City, and we did some interviews around that. The trauma related to that. And whenever we do these interviews, we always end up talking to reporters longer about the impact of trauma. And while we were doing that, I was thinking, we really ought to try to do this on Wednesday night and really talk about this. I've mentioned frequently about the impact of trauma. It's one of the questions I always get when we talk about our rates of mental illness in the state, substance use issues. Somebody always asks why are these rates so high? And I always point back to trauma and the rates of trauma that we have in the state and how that impacts our future as far as behavioral health. And so I thought it would be a good opportunity for us to maybe talk about that a little bit. And Lauren, I don't know that everybody, I listen to you all the time and I get to hear all this, but I think it would be interesting for people, when we're talking about trauma and how that relates to behavioral health issues, what are we really talking about?
Well, of course you have experiences, the traumatic experiences that can lead to PTSD, but we also know that traumatic experiences, they can lead to other kinds of mental illness. We can even, of course, depression, anxiety, adjustment disorders, personality disorders, and even you can have kind of a traumatic onset of a bipolar disorder, where people have experiences, and especially like ACEs, which are typically early in life prior to 18, those disrupt your development and the way your brain comes together and the way you experience the world. and it can affect you in a lot of ways, even outside of PTSD.
And would it be correct if we're saying that also there, I don't know how really to say this correctly, but it can happen later in life that the trauma is coming back, the trauma that maybe you've had buried or that you've been dealing with throughout your life. You talked about I'll say triggering effect, something that happens to bring this up when we're talking about bipolar disorder, and how that can come up and really make the disease progress.
Oh, yeah, absolutely. People have these experiences, really just dysfunctional and traumatic experiences in childhood, and they don't know in some ways that how they feel or the ways that they regulate emotions, how they can't sleep at all. They just think they're a bad sleeper. They have no idea that it's related to their traumatic experiences, and they cope and they think that this is just who they are. Sometimes they think I'm broken, or I'm crazy, or even just I'm weird and I've always been like this. And they don't know until sometimes later in life, they might have an experience. They watch something like this, they listen to a podcast, and they're like, oh my God, did all that stuff affect me? Is that what's happening here? So that's it. And then of course, like anniversaries of traumatic experiences, like the bombing, it brings it up every year and it brings back those feelings and thoughts.
Yeah, that's something that I struggle with every year at this time, and still deal with because of where I was at that point. Actually, on the phone with one of our offices in the building. I was with the federal government at the time. My brother-in-law was in the Journal Record building, and it had a profound effect on him and on our family from that. And I think those are some of the questions about. One, I'm going to say, is it normal? Using normal very broadly for people to be affected by this when that comes up, and really, what have we been seeing specific to the bombing? So that's an issue we should talk about. How does this work? How do these images bring these experiences back, and being exposed to different images bring these experiences back? And how does that affect us in long term?
Yeah, for one, yes, it's normal. A really common phrase in trauma world is that your trauma responses are a normal reaction to an abnormal experience. And traumatic events, like, they exceed our coping big time. They exceed the way that we've adapted and made it through life and the skills that we have. And that's like part of what makes it traumatic. It's the experience and how we struggle afterwards to cope with that and the effect it has on us. So it's extremely normal. And then when these anniversaries, they start coming up and we're thinking about it. It turns April and it's on every Oklahoman's mind. I'm a native Oklahoman, right? I was alive when the bombing happened, and we all have, it's April 19th is coming. And so you feel that. And of course, the closer you were to that experience, to the bombing, whether that was being on the phone, right, with someone or losing a loved one, you feel that day coming, the day that your life pivoted and wasn't the same after. And so it brings up those feelings. And then when we look at the images and we're hearing stories even, it can make us bring up memories and feelings that we haven't revisited all year. And they feel big and they feel overwhelming because they are. And so, of course, it can be distracting to your life. It can get in the way of focusing at work or paying attention at home, or even while you're driving. You think, where was my mind the last 5 minutes? And that's all normal. It's all things that when it starts to really interfere with your life, we would love to get you help. Hopefully you can find connection to getting services for that, because when it's really interfering with your life, there is treatment for that. But also having a difficult few weeks, that may be something that a lot of people experience every year forward, because the event is that big and it matters that much.
Lorna, did you guys see anything? So Lorna, NAMI Oklahoma, premier advocacy organization in the state of Oklahoma. I know you get calls all the time. Did you see an uptick in calls last week surrounding the bombing anniversary?
Not particularly surrounding the bombing, but we have seen a lot more calls just around, I think, the collective trauma from the country from COVID and what's happened there. So that's really been where we've seen a lot more an increase in calls.
Yeah, we've talked a lot about the experience. We have young people. We have higher rates of depression, anxiety, reports of stress. We have young people who are reporting that they are feel hopeless. We recently, just a month ago, there was a report of, I won't call it a contagion, but certainly an uptick in suicide attempts for young girls. And what is it with your work with families and what you're experiencing there? What are families saying about this? Certainly, you're working with families that have experienced loved ones who are experiencing mental health issues. But are you also seeing others maybe reaching out, looking for help, looking for signs and symptoms and what they might be able to do to head off some of these problems?
Yeah, I think that talking about the Murrah bombing and with COVID, where we've seen a lot more calls from providers or first responders that are needing that care that we provide, whether it's a family member of someone who's working in the field or if it's some professional themselves that is seeking help.
Lauren, that's a kind of a good point to bring up in the work. I've talked about before on here about the work that we're doing with first responders, law enforcement, and giving them a chance to outreach. And in your work with trauma and being involved in this, is this something that needs more attention as far as working with the first responders and the people that have been involved with the bombing issues and other things that they might be seeing in the community?
I would really agree with Lorna that we've been really aware in the last 2 years about what the stress is of the job for first responders, whether that's stemming back to the bombing or just the day in, day out of what they see, death, injury, how they're treated by people, that they're trying to help. That's a lot of stress and trauma. And there's the stigma that people face thinking, I've got degrees in this. I'm a professional. I know everything they're going to tell me. And we have to break that down so that people know therapy, counseling. It's not about us telling you what you don't know, right? It's about making sense of experiences together and helping you see things that you already know differently. So it's really important work and breaking down that stigma, especially for like law enforcement and medical professionals. Therapists, I hope, are a little more open to it. Like a lot of us have done a lot of therapy before we did therapy, right? But being available and letting EMS, right, or letting them know that this is, again, normal reaction, abnormal experiences. And you don't have to, this isn't just how it is when you're a first responder. You don't have to live with that type of intrusive thoughts and avoidance and the ways that it disrupts your life. You can have a fulfilling life without giving up your career or anything like that.
And I would imagine it has an impact on their families also. If a first responder is going through this, that can also impact your family and children growing up in the household. Is that correct?
Absolutely. It comes out wherever it does. And a lot of times first responders are so skilled, right, at shoving all of the emotions and the stress of the job out of their mind when they're at work. But you come home and then you can't hide from those feelings, and they are there, and it comes out in your marriage and your relationship with your kids, your family, your friends. And so that's a common issue, is the way the work trauma impacts families, whether that's through divorce rates or just disconnection with their family and stress at home. And that's absolutely, it's something we could spend a lot more time on, is breaking down that stigma and access and helping them find care that works and that matters for them.
We talk a lot, so thinking about trauma, ACEs comes to mind. Everybody likes to talk about ACEs. And I don't know that anybody really has always explains it. Can you talk about that a little bit and what that means, how that translates into experience in adulthood?
Yeah, so our ACEs, the ACE study is really about 10 particular adversities, things that can be traumatic, but are typically at least adverse childhood experiences, right? That's what it stands for. And these are things that people experience prior to the age of 18, like growing up in a home where a mother's treated violently, in a home with substance abuse with an incarcerated family member, or even directly experiencing different kinds of ACEs. And that, again, is the way that some of these things in and of themselves are traumatic. Experiencing abuse is typically traumatic for someone, whereas there may be something more subtle, where if you grow up in a home that has a lot of substance abuse, or you grow up in a home with an incarcerated family member where one of your parents is incarcerated, that is not necessarily something bad that's happening to you in the way abuse happens to you, but it's something that's not happening for you, right? You're not having that loving, safe connection with your parent because they're incarcerated. And that disrupts the way that kids grow up and the way that they develop and appreciate safe relationships, right? And the way that they connect to other people, because our caregivers and our parents, those are the people that we learn how to love from, right? And so these adverse experiences, even when it's not an adult doing something bad to you, there's still this fallout, right? You could have a really loving incarcerated parent, but it still has a negative impact on you that you have to address and work through later in life.
Yeah, I think of, I'm from rural Oklahoma. I grew up in rural Oklahoma, and I can think of families that I grew up around, and I think many Oklahomans, not just in rural Oklahoma, but in other parts of Oklahoma also can see this cycle happening of negative consequences happening with these families. And as I've learned more, I know more now that we're seeing these negative experiences that are begin in childhood, moving up into adulthood, and that cycle repeating itself in a really a generational type of trauma that's occurring. Can you talk about that a little bit? And I know also that there's a project underway that I really want you to mention.
Yes. So absolutely, this intergenerational cycle where families don't have access to care, or they don't access it, whether it doesn't feel like they're going to get their needs met, they don't have transportation, right? It can be a physical barrier or an emotional barrier. And what we absolutely want to do is find treatments that meet the family, right? And work on just the family. They don't just say, oh, you have a kid with problems, we're going to fix your kid's problems. They say, whoa, we're going to get your child's development back on track, rebuild your relationship, because we know that one of the best things for a child to grow up healthy and strong and resilient is having that caregiver relationship and making that as strong as can be. And so one way that we are working on that is through our East OKC project. It's a National Child Traumatic Stress Network grant that we were awarded. And we are we're focusing our services on 10 zip codes in East Oklahoma City, where we're providing particularly 2 treatments. One is for really young children. Even you can start it when the mother is pregnant, and it goes up through 5 years old. So it's prenatal through 5 years old, to help children who have exposure to adversity, because we know that adversity can start in the womb, right? We know that that's true. And to build that parental, that dyad bond is what they called it, that caregiver bond, so that whether they're with a biological parent or with maybe a kinship placement with an aunt that's raising them, that they grow up with those safe, healthy attachments. And the same with one of our other treatments, where we work with kids in groups, and then we work with their caregivers in a group to really work out helping to support each other and building up that social support, and not just saying this is a personal problem you have symptoms and we got to treat those, but to say you need connection to other people and you need that relationship with other people to be the best version of yourself, and we're going to help you foster that.
Yeah, I think that, so that's one of, I know we've talked about that a lot, and it's tied back to, I think this is a point I'm trying to say, and I want you to affirm it for me, that this is tied to some evidence-based approaches that have been tested. We know that these deliver positive outcomes. I always think that's important to talk about a little bit.
Absolutely. Our 2 main treatments are trauma-focused cognitive behavioral therapy, adapted for a group setting. And so TFCBT for short is one of, if not the most studied treatment for trauma in children. I mean, it's the gold standard treatment, but we know that families in communities with high ACE scores and high adversity, that they may benefit from group treatment, where they have the opportunity to say, I'm not alone. This other person that looks like me, that lives near me, right? Whatever it is that they feel connected with, that helps build that peer support, which is so critical for, again, being resilient and having a healthy life. And our other treatment, the one that you can even do prenatally, as wild as that sounds, it's called child-parent psychotherapy. And it's also evidence-based. Hasn't been around as long as TFCBT, so nothing can compete with that in terms of the research, but we know from good research that it works. It's evidence-based. There's a lot of research behind it. And we get to work with some of the best trainers for both of these in the country in order to make sure that we're doing it in the way it's designed to be done, and that we're getting our outcomes and doing this in a way that science tells us will work.
Yeah, it's this preventative approach. It really can work to stop these cycles, the negative cycles that we've seen in families from generation to generation. And I really like the idea of coming in and proactively addressing these issues. I would think, Lorna, this is something too that likely would be very helpful for what you're hearing from families and who you're working with about stopping these cycles and providing different means to address issues that maybe haven't been there before.
Yeah, I mean, we're trying so much to bring everyone into the fold and make NAMI more accessible. So offering programs like Sharing Hope that is for the African American community. So you have someone who looks like you, who's been through the same experiences that you've been, to lead family support groups. And so we know that having someone there that has walked that walk and has come through it, that can share their stories, is so helpful.
Yeah, I think, and it's very important for the advocacy community, I think, to be working in partnership with what's happening from a treatment standpoint and what we're doing here at the state. It's vital for getting that message out and really having an impact. I want to touch on this just real quick because I have you on here, Lauren. We have a lot of discussions around domestic violence issues. We certainly have talked a lot about the trafficking, sexual assault. I'm careful how I walk around this, but I would like to talk about that relationship a little bit from a victim's perspective and what we see and what we need to be doing. I think need to be doing more. This is an issue that's prevalent in Oklahoma, doing more to where we can reach out and help these victims. But you might talk a little bit about that also.
Yeah. I think it's a similar situation, that one of the biggest risk factors for somebody continuing to be stuck in an abusive relationship, and even for that victim contemplating suicide themselves, is social isolation. And it is it's a tactic of abuse to isolate victims socially so that they don't have connections to say, my partner did this yesterday and I didn't like that. It didn't feel good. It was terrible. Is that normal? Right? To kind of have people to reach out to undo some of the manipulation that they learn in the abuse and are told is normal. And that social connection piece is something that we have to be thinking a lot more about as a community, that we have good access to treatment for the most part, right? We have so many supports. What we don't always have the most of is people in people's lives saying, hey, it seems like there's something going on between you all. People being willing to say that to a victim and to say, are you safe? Do they treat you okay? In a non-judgmental way. And also, if we're being real honest, people being willing to tell their friends how you treat your wife is not okay. Right. What you say to her, that's not okay, man. And you need to stop, right? That we can clean up, in a sense, domestic violence as much as we want. Referring people to get VPOs, helping them get therapy or divorces, and helping them leave an unsafe situation. But leaving abuse doesn't stop abuse. Only an abuser can make the choice to stop being abusive. And we have to have communities that are willing to say, I am somebody who will hold my friend accountable, who will tell them that their behavior is intolerable, right? And stick it out with them, right? To be there for them through that. and to let them know this isn't okay. And I've got to find a way as a community to enforce the stopping of it, without just having a reliance on victims to being willing to do so much of the heavy lifting to escape always.
Yeah, I really think it's up to all of us to have something to do with this, to help make a difference. This is an issue that's really impacted Oklahoma, and certainly something we need to address, and all of us need to take ownership of it.
Absolutely.
Hey, Jeff, I had a question for our experts as we look at the month of May coming up. And, 2 years ago when we started talking on Health Watch Oklahoma, and we watched through the situation with the pandemic, and then we saw a lot of media waste time on ivermectin and whether or not that you could do blue lights under the skin. You remember those days, right? I mean, we wasted a tremendous amount of time on these nonsense issues. And when one of these statements we made, the media would go happily along to, follow. And sometimes the media would catch it's like the dog chasing the car, right?
Right.
It would catch the car and like, what do we do now? And as the doctors, the Fab Four would say at the time, we have so many things that are happening in the background. We're not addressing mental behavioral health being one of those. So as we've seen the social media expand, and Lauren was just talking about social isolation, people that are doing that, they get on the different social media aspects of it. The media they've learned the politicians have learned this is a good magnet for attention. We see that every day. We have this legislative session. We had this new term, is basically performative filings or bills that they weren't going to go anywhere, right? But they got headlines, okay? And news media would follow those stupid bills, and they would just they would waste time on this. So it's kind of like you've got to get back to square zero or first base, whatever you want to call this, in terms of helping people understand that actually can do something about this. A budget's being crafted in Oklahoma. There's deliberations for the next few weeks on this. You've got media involved that disseminate these messages. So here's my question. That setup, which is basically from the families, Lorna, which you work with, and Lauren, the therapist on this. What do the different people that can make a difference? We're talking media, we're talking politicians, we're talking the engaged public. When it comes to the things that are happening right now in trauma in Oklahoma, and based upon what happened over the last couple of years, what are one or two issues right now that are totally being ignored by press, by the public, by politicians, that we really need to do something about right now, or it's in a situation where things could get out of hand? Lorna?
Well, I would say access right now to providers. We have so few providers out there, and there's so much need, and we have to have a way to keep our providers from having burnout. We have to make it easier for someone to call and make an appointment. And when we talk about, people who have all of the ability to call, they have insurance, they have income, they have everything that they possibly could have to make it an ideal situation, and they're on waiting lists for 6 months to a year to have either themselves seen, their kids seen. That's a real issue. And then I can't even imagine if you're a child who doesn't have a parent who has those resources, finding help.
Laura?
I'd say for me, two things. One is our suicide problem. We have a serious issue of suicide being on the rise, especially adolescent suicides, and educating people on how social media can be such a double-edged sword for your mental health, right? On educating providers on these are the best ways to treat suicidality. What do we do about that? And I would really agree with Lorna. I think we have a clinician shortage. We have a real therapist shortage around the state. I don't know what the solution is, but I know that our therapists are leaving insurance companies in droves because they're not being paid fairly. That they're not, I should say, this is mostly private insurance companies, right? That they are not being paid fairly. That's, it's a corporate game, of course. But how to not pay them for services they already provided. So they're leaving, and that makes therapy more expensive. People are not getting coverage even when coverage is available. And that's really, really difficult to find a therapist right now. And the issue is not necessarily people won't go out and find someone, but that if you have private insurance, you're going to find a long list anywhere you go. And that's such an issue when we're, again, on the tail end of several years of an extremely trying time for our collective mental health. And people are getting out of their houses and they're starting to say, I'll leave and I will go get help because I feel okay to do that. And we don't have as many therapists as we might need to really meet all of their needs.
Right.
Jeff?
Well, they're hitting on it. So we call it parity. We talk about parity. There's laws in place that say there needs to be parity. Mental health issues need to be treated the same as any other physical illness. It's not that way. And I've talked to various people, and we talk, well, how do you define a mental health issue? Or the mental health issue, it's tough for us to define, so it's difficult to cover it. Brain diseases are tough to define, but there are a lot of other illnesses that are tough to define also, and we found ways to address it within the medical system. This is its parity is keeping far too many families from getting the help that they need. They're paying high prices for insurance. This insurance should be covering their needs. Also, it's costing us significantly. It's costing us at a state level because families aren't able to access services. People aren't able to get the treatment they need. They end up out of work. They end up not being able to afford that insurance anymore. So we pay on that end, but it also leads to other physical ailments that insurance is paying for. It is time we really have an important discussion about parity, why things aren't working, and find some solutions to it. We also need to be talking about stigma. That's still too much of a barrier for far too many people in being able to access care when they need it. These are very important things that we need to put more attention to.
Well, it's nice to have experts that can help us cut through the nonsense. We've been trying to do this segment for some time, as Jeff has talked about, and we moved to every other week to talk about behavioral health issues and how important they are in Oklahoma. And we've got the speaker coming up, but Lorna and Lauren, want to thank you for being here tonight. Thanks for all you're doing. If I could, okay, jump here in front of Mr. Dismukes, but Lorna, could you talk a little bit about NAMI, what your organization does, how people find you, right, and what Oklahoma can do for your organization?
So NAMI is the National Alliance on Mental Illness, and we were started in 1979 by a group of families sitting around a kitchen table who had children who'd been diagnosed with a mental health condition, and they didn't know what to do. They didn't have peers that they could go and talk to and figure out how to not be blamed for the situation that their children were experiencing and remove that stigma. So here in Oklahoma, we started in 1985, similarly with a group of families who wanted to have other people to talk to and share their experience. And so what we do here is we have support groups across the state for family members, for peers who have a mental health condition. We do educational classes. NAMI Basics is for parents who've had a child who's been diagnosed with a mental health condition, so you can learn the language to use, resources that are out there, and your own coping mechanisms. And we also, we have an 800 number. You can call 1-800-583-1264 to get in touch with us. We can connect you with those support groups. We can get you registered for any classes that are out there. We're just a resource for families and peers that are experiencing mental health conditions.
And Lorna, you guys can help with the things that we were talking about a minute ago with the issues around parity, how to navigate the system. You're a resource for that also, aren't you?
Yes. Yep. We get calls every day for people, who've had a child who attempted suicide. Where can they go? What can they do? What are those resources that they need to have access to? And then, finding available beds. Sometimes we're looking across the state to find somewhere that someone can take their loved one to receive treatment. So we try to help as much as we can doing that to help relieve some of that burden and be a partner with someone's journey.
Scott, May is Mental Health Awareness Month, and there are a lot of events going on around the state. There's the BOK Center and the Cox Convention Center in Tulsa are lit up green for the entire month. I know that the Oklahoma County Courthouse will be lit up green. Skydance Bridge will have days it's lit up green. There are several businesses that are lighting up green to help spread awareness about these issues. There are a lot of events that are also happening, and really need to bring up NAMI. NAMI has a premier event they've been doing for years called NAMI Walks, and that's coming up in Oklahoma City. And Lorna should probably mention that and how people can become involved.
Yeah. So the NAMI Walk is May 21st. It's Saturday at the Myriad Gardens. You can register at namioklahoma.org. It's free to register. So just go on there, register yourself, your family. It's for anyone who has been impacted by mental illness. It helps us raise funds for the programs that we offer throughout the state. We're going to have, it's a 5K walk. You walk around the Myriad Gardens, but we'll have yoga, we have Zumba, we have face painters out there for the kids. And then that starts at 8:30, where we open up with our vendors, our sponsors, and all those activities. But at 7:30, we have a remembrance ceremony for those who've lost a loved one due to mental illness. So it's anyone who's lost someone who may have completed suicide, lost a loved one to the criminal justice system, just anyone who's experienced loss due to mental illness. And it's a really important ceremony that we do. And we're the only NAMI walk across the country who does that.
Very nice. Thank you for being here today. And of course, I know we blame Dismukes for that, for getting folks out on their family time in the evenings. So thanks very much, Lorna, for being here. And before we get out of here, first off, I'm going to make sure, Jeff, that I got this right. She's the senior manager of Zero Suicide and Trauma Care. Did I get that right?
Yes, you did. Nailed it.
So I know you're a colleague of Jeff Dismukes, but can you tell us what I'm interested in Zero Suicide and Trauma Care, the division there at ODMH? I still can't get this, Jeff. ODMHSAS. Okay.
Nailed it. Yeah. So Zero Suicide is a national movement, and it's based on the idea that zero suicides are possible, right? It's lofty, it's ambitious, but there's no reason that we can't get there. And so that's a really particular framework. It's evidence-based. That's what my team is in charge of implementing, our zero suicide standards, working with providers across the state to implement that. And it's just this idea that we can prevent suicides among people in care so well because we know what to do. We just have to do it. And then on the trauma care side, that trauma is an issue across the lifespan. And that's what we work to identify projects and grants and support our providers as they are looking for what's the best practice, what are their standards of care, what evidence-based practices, again, should we be implementing, and trying those out and then helping disseminate those. Finding a small project is a lot of times how we start, and then learning from that and expanding it and taking that statewide.
Well, it's ambitious.
It is.
Really
Nothing short of it.
Yeah, it's really an incredible division, and I'd heard all about it, and you're an incredible leader, and thanks so much for being here with us this evening.
Thank you for having me.
Lauren Garder and Lorna Palmer. I got it almost correctly. We did not mess up Lauren or Lorna tonight, did we, Jeff? I messed up Palmer, but
got that. I was worried about it. I was having a hard time. I kept looking at the names on the screen. So.
All right. Thank you both for being here.
Thank you.
Thanks.
Thank you.
Have a great evening. Okay. Your thoughts about that particular panel? That was really informative, and there's a lot of work to be done. Is my takeaway.
Yeah, and I think in future shows we'll probably get into the parity issues a little bit more in the workforce shortage. Those are really important issues to talk about as we move forward. And I saw comments coming in talking about struggles that individuals are having trying to find those services for their families. It really makes it tough, and it's something that's kind of fallen, I think, under the radar as we talk about some of these other issues that maybe have grabbed attention. There's a real need to talk about these other things, though, because that's what's really impacting the system. And what Lorna was talking about, that's really impacting access. Access is a key. If we're going to get in front of these issues, make a difference for generations, then we need to do something about access now. And, it's hopeful. There are a lot of things coming. There are a lot of things that we'll talk about also in future shows about changes to the system. But still, that workforce is a priority, and the issue of parity is something we must address. It's been too long.
It has, and workforce development, especially in this particular field, something's being talked about at the Capitol as we speak on those issues. And Jeff and I will be back just a few minutes to wrap up some comments. I would say before we go to break, you have some ideas about future shows, topics you want, throw them up in the comments, send them to me by email, scott@mitchelltalks.com, and I'll pass them on to Jeff Dismukes. All right. Here's this week's exclusive interview with House Speaker Charles McCall. It's time for our weekly visit with Speaker Charles McCall. Mr. Speaker, good to see you.
Good to see you, Scott. Great to be with you again.
Since we last talked, Project Ocean, the legislation begun in the House, is now into law. Your reflection back, we talked last week a little bit how the process started, but now that it's law, it's got the governor's ink on that page. What do you think about that process and how it's going to be affecting the budgeting process moving forward?
Scott, you're right. The LEAD Act was signed into law last week by the governor, which is basically the vehicle for economic development incentives for Project Ocean. Right now, that vehicle is law. That fund is law, but there is no money in the fund until the legislature appropriates the money. We're waiting to see what Project Ocean's their official notification that Oklahoma has been selected, and at that time, the legislature will make the appropriation into that fund. That will be a separate activity from the budget itself. In terms of the annual appropriated budget of state, that's something that's been going on all session. Starts with the state of the state when the governor presents his budget to the legislature in joint session. We have that, then our leadership and our members begin working on that to a number certain once the Board of Equalization certifies a number for us to use. So, the process this week is our final deadline week for policy bills in the legislature. All Senate bills have to pass the House floor this week in order to move on either to conference or to the governor's desk for signature or veto. The budget is the process there. We have multiple sub-appropriation committees in the House. Each one of those take one section of the budget and work on that throughout the session, and then we can begin having conversations with the Senate and the governor about what we think the appropriate budget amounts need to be for the upcoming year. Once again, we have record surpluses, Scott, this year. Our savings is at a historical high. I think we'll end the session doing some great economic development, some inflation relief for the people, and still have strong reserves for the state. That state would be able to weather an economic downturn if we experience that in the future sometime.
Obviously, trying to prognosticate what's going to happen in the month of May, it's a bit of a mystery every year. It's like picking the NFL draft, which happens tomorrow. I mean, it's hard to predict, especially when things come along, such as Project Ocean, and it's an election year. You have all of these things, but we're moving into May after the deadline this week. Tell us, for folks that are watching this and trying to figure out exactly what happens in the mysterious month of May in the process, what we should be looking for to see where we're headed.
You bet. And what everyone in the state should know about their government is that our state's constitution mandates that we have to finish everything by the end of May, the last Friday in May. So the month of May is really, there's a large concerted effort to fulfill our constitutional duties and adjourn by the constitutional timeline, which once again is the last Friday in May. So the budget, although the budget's being worked on throughout throughout the 4 months of the legislative cycle or the legislative session, it really starts to come together and has to come together in May. And so what people should expect to see the legislature doing is bringing all of those issues and matters of discussion and debate throughout this legislative year to a culmination in the month of May, both policy-wise and through the and budget-wise through appropriation.
Now, a lot of people understand there seems to be more formality in those first 4 months of the session. You see the committee meetings, you know, when they're happening, all of these sorts of things. It becomes a little more muddied in the month of May. Also, in terms of just the wear and tear on your members, Democrat and Republican alike, there's very long days. Sometimes tempers can flare. It's an election year. A lot of people want to go home. How do you see this one compared to other years that are similar? I mean, this is like your sixth session, I believe, as speaker. So how is this stacking up to where it's been in the past? Are you optimistic and hopeful this one's going to be orderly?
Yeah, I think there's an opportunity for us to finish this session well before the deadline, and let me be clear, we will finish by the constitutional deadline. It's the fourth month that we've been in session. It's the fourth month that we've been away from our districts, except on the weekends we get to go home, and so yeah, there's a lot of fatigue in the month of May, just from the previous 3 months we've been through, and then all the additional work and time constraints that you have in the month of May. Now, I'm very happy with the progress of the legislature in the House this session. We've worked ahead of schedule. We were short a week this year, just from where the first Monday in February fell this year, which is our constitutional date to meet and convene for the legislature. But everybody has been working very hard, very diligently. And tempers frustration and fatigue can set in a little bit in the month of May, but we're constantly communicating, working with our members to stay focused and get the work done. So, and they are, I like everybody's attitude at the moment. Both sides of the aisle, I think, are functioning very well. We certainly have our differences of opinion on policy and even the budget at times, but that's okay. That's what the process is designed to be. But at the end of this, sometime in the month of May, we will sine die, adjourn, and have everything set for the next year.
Last question today is, we've talked about the LEAD Act and what happened there in the budgeting process, public policy. You had ambitious goals this year as a leader of the caucus there in the House and in the entire House of Representatives as Speaker. Where are you at in terms of being satisfied with where your public policy goals were at the beginning of the session?
Yeah, we're very happy. We had very concise public policy priorities this year with broadband, the medical marijuana issue dealing with illegal grow facilities and operations in the state, and standing up more enforcement and regulatory oversight. Those were key priorities for this session. Those things seem to be moving pretty well over in the Senate. On the budget, the economic development side with Project Ocean, that's something that we were not aware that presented itself. But it's one of those great opportunities that we were in the right time, the right fiscal position to pursue. So I think we have, of course, this maintaining a solid level of reserves for those future economic downturns is very important, and we seem to be on trajectory to continue to grow that. So overall, I think this is going to be a very positive session. I think a lot of things have been accomplished, that not only for the immediate year, but really sets the table up nicely for Oklahoma in the future to continue to experience continued prosperity and growth.
Mr. Speaker, I guess it's best said, down the stretch they come. Take good care. Thanks for all you do. We'll see you next week.
Hey, thank you, Scott. Great to be with you again. Take care.
Thank you, sir. Okay, so, you've been around a long time. You know that.
Yeah.
For people that remember this, we had a tornado outbreak in 1999. You remember that?
Mm-hmm.
Moore, the first one that Moore took the brunt of that damage, but that was a series of outbreaks from May the 2nd through the 8th of that year.
Mm-hmm.
And there was a town in Oklahoma called Mulhall that just about got wiped off the face of the planet. And the tornado there was bigger than the one that went through Moore, according to folks that do that sort of measurement. And people are going, all right, he's lost his marbles. What's he talking about? The speaker said early on, this is the deadline. Thursday will be the deadline for public policy bills. Okay. Differentiate the budget bills. There's only so many people in the media that can cover everything that's going to happen in the next 72 hours, next 48 hours.
Right.
And we'll be learning about what happens in these bills in 48 days, for example. It's just, that's how much news comes out. It's kind of like the 99 tornado outbreak. There was very few people in Oklahoma know about the Mulhall tornado, except if you had family there or you lived in Mulhall, that was a bigger tornado than the one that decimated Moore. And it's the same way about these bills that are going to be coming out of this legislature. There's too many bills. There's too much public policy, not enough people to report on it.
Right.
And it's going to be something, it will take days and days and weeks to figure out what's happening. But specifically, that deadline is just about public policy. It has nothing to do with the budget. Now, the speaker says you got to sine die by the 31st. And I can assure you there is no intention of anybody in that building right now staying around to May the 31st, right, Jeff?
Right. Yeah, that's the way it always is.
Okay. Thanks tonight to our viewers. And we've had some questions. I think you've already referenced some of those. And again, just throw up in the comments, send us an email, Scott@Mitchell Talks. I'll get that on to Jeff about future topics, future guests. The guests tonight were great, talking about conversations that we've got to get people a little more familiar with, access being one of those. So, and treatment. Your final thoughts tonight, Jeff?
I just appreciate everybody coming on tonight, taking time out of their schedule to talk about these issues. But, also I appreciate you being able to provide this forum for us to talk about behavioral health in Oklahoma. It's important that we do this, and it's important that we all learn more about these issues, whether we've been impacted by it yet or not. As a family, the percentages say that we will. 1 in 4 Oklahomans are impacted by a behavioral health disorder in one way or another. So it's important that we learn about this. It's important that we move forward and address these issues to prevent, to treat, and help people find recovery. It's imperative for the future of our state.
All right. Well, thanks for putting that panel together tonight. And we should make sure you understand, just because there's a deadline on getting those bills across the line on both sides, that doesn't count the ones that are in conference.
Right.
So we'll get into that probably Saturday morning on Hot Seat. All right. This is Scott Mitchell saying have a great afternoon or great evening, everyone. Same for Jeff. You have a great evening. We'll see you next week.
Thank you.
All right. Good night.
Good night.